There's a question many men start to silently ask themselves, especially after turning 60 or 65. It's a topic that often feels too personal to even bring up with a trusted doctor. That question is, does what I do in private affect my health? Is frequent sexual activity or masturbation helpful or harmful? And more importantly, could any of this be related to prostate cancer? Today we're going to talk about this openly, as if you were sitting in my office. Because your private life, what happens behind closed doors, can actually influence how long you live, and more significantly, the quality of those years. I'm Dr. Bryam, and together we'll uncover what science truly says about ejaculation and prostate health. We're talking about a small gland, about the size of a walnut, but with a major role in your body. Stick around because the truth might really surprise you. To properly understand this subject, we need to meet the key player, the prostate. Think of it as a tiny factory located just below the bladder. Its main role is to produce a crucial part of semen called prostatic fluid. This isn't just filler, it's a rich mix of zinc, citric acid, and important enzymes that protect and support sperm cells. But the prostate doesn't act alone. Semen is a team effort. The seminal vesicles contribute most of the volume, filled with sugary fluid to fuel the sperm. Meanwhile, the testicles add only around 1% of the total. But it's the most essential part, the sperm cells themselves. All of this combines to form semen. So how does it leave the body? Ejaculation is a remarkable two-part process. First is the emission phase, when all the fluids gather in the urethra, ready to go like performers behind a curtain. Then comes the second phase, expulsion. With the right stimulation, the pelvic floor muscles contract powerfully, propelling the semen outward. This finely tuned dance depends on perfect communication between your nerves and muscles. That's why conditions like diabetes, or as we'll see later on, certain prostate surgeries, can interfere with this process. One of the most common questions I get in my practice is, Dr. Bryam, is it harmful to hold it in? Is storing up semen potentially bad for your health? The short answer is, there's no solid evidence showing that refraining from ejaculation directly causes any serious illness. However, that doesn't mean it's entirely without effects. Think of a river that stops flowing. The water begins to stagnate. A similar thing can happen in the prostate. In men dealing with chronic prostatitis, which is a persistent and sometimes painful inflammation of the gland, infrequent ejaculation can actually make pelvic congestion symptoms worse. In fact, a study as far back as 1999 discovered that increasing ejaculation frequency, whether through sexual activity or masturbation, helped many men experience relief from these uncomfortable symptoms. It's almost as if ejaculation helps flush out the system, lowering internal pressure and reducing inflammation. There's also another benefit that's often overlooked: better sleep quality. Ejaculation triggers the release of hormones like prolactin and oxytocin, both of which promote calm and restfulness. A 2023 study published in the journal Sleep Disorders showed that sexual activity, especially when ending in orgasm, significantly improved both how fast people fell asleep and the quality of their rest. So beyond the pleasure, maintaining an active sex life might just be the best natural sleep aid you've got. But now let's address the question I know many of you are waiting for, the one that causes the most concern. Does infrequent ejaculation increase your risk of prostate cancer? Or, put another way, does frequent ejaculation offer protection? Science has been investigating this for decades, and the findings are, to say the least, very compelling. Let me take a quick sip of water, and while I do, I'd really appreciate a small favor from you. If you find this information helpful, go ahead and subscribe to the channel and tap the like button. It's free for you and means a lot to me in supporting the creation of more health content like this. Thank you sincerely. Now back to the topic. The most comprehensive and influential study on this subject came from Harvard University. Researchers followed nearly 32,000 men over the course of 18 years. And what did they discover? Something remarkable. Men who reported ejaculating 21 times or more per month had up to a 33% lower risk of developing prostate cancer, compared to those who ejaculated only 4 to 7 times a month. And here's a key takeaway. The study concluded that it didn't matter how ejaculation occurred, whether it was through intercourse or masturbation. The protective effect appeared to be linked to the physical act of ejaculation itself, not the presence of a sexual partner. Several other studies have confirmed this finding. A 2017 research project and a large meta-analysis in 2018 both reinforced the same inverse relationship, meaning the more frequent the ejaculation, the lower the risk. Now, as a scientist, I must be transparent. These are observational studies that rely on self-reported data from men, which can sometimes be inaccurate. But the consistency across multiple studies is so strong that it forces us to ask, why is this happening? What could be the biological explanation behind this apparent protection? There's no single definitive answer, but the scientific community has proposed several compelling theories. The first, and perhaps the most straightforward, is the flushing hypothesis. Think of the prostate as a sponge filled with small ducts. Over time, harmful substances, such as environmental toxins or chemicals from tobacco, can accumulate in the prostatic fluid. Each ejaculation acts like a rinse cycle, helping to remove these substances before they have a chance to damage nearby cells. When ejaculation happens infrequently, those toxins may remain in prolonged contact with prostate tissue, increasing the risk of mutations that could lead to cancer. The second hypothesis involves hormones. Frequent ejaculation might help maintain a healthier hormonal balance within the prostate, keeping testosterone and other androgens in check, which in turn could prevent uncontrolled cell growth. A third explanation that I find particularly fascinating is that sexual activity may mimic the effects of exercise. It stimulates the immune system, your body's defense mechanism, not just against infections, but also against abnormal or cancerous cells. A well-functioning immune system is better at identifying and eliminating threats before they become serious. Lastly, researchers suggest that the muscle contractions during orgasm could enhance blood circulation, reduce local inflammation, and lower oxidative stress, an important factor in aging and cancer development. After hearing all of this, the big question becomes, Dr. Bryam, how many times should I be ejaculating each month? And I want to be absolutely clear on this point. Even though the study highlights the number 21, that isn't a medical prescription. It's not a goal you need to push yourself to meet. Sexual health is not a contest. The ideal frequency is entirely individual and depends on many factors. Your age, your overall health, whether or not you have a partner, your stress levels, your mood. The list goes on. Trying to force yourself to hit a specific number can actually backfire, creating stress and anxiety, which are harmful to your well-being. What these studies point to is not a rule, but rather a general idea. Staying sexually active and maintaining a regular pattern of ejaculation appear to be part of a healthy lifestyle that may help protect the prostate. The key is to listen to your body and find a rhythm that works for you, free from guilt or pressure. Now, I'd love to hear from you. What do you think? Do you believe there's such a thing as a normal number, or is it something entirely personal? Share your thoughts in the comments. I'm genuinely curious to hear different points of view. And while you're at it, don't forget to grab a glass of water. Hydration is just as essential for your health. All right, let's move on to a topic that concerns many men. What happens to ejaculation after prostate surgery? This is where it's crucial to understand the difference between the two main types of procedures, because their outcomes are very different. First, let's talk about surgery for benign prostate enlargement, also known as benign prostatic hyperplasia, or BPH. This is the most commonly performed procedure. As men age, the prostate can grow large enough to press against the urethra, making urination difficult. The goal of this surgery is to clear the blockage by removing the inner tissue causing the problem, while leaving the outer capsule of the prostate intact. The most common side effect of this procedure is something called retrograde ejaculation. What does that mean? It means that during orgasm, instead of semen being expelled outward, it flows backward into the bladder. This happens because the surgery affects a small valve, the internal sphincter, that normally closes to prevent semen from flowing backward. It's very important to understand that you'll still experience orgasms after the procedure. The sensation of pleasure remains intact, and erections typically aren't affected. The only difference is that you won't see semen being released. Instead, it's redirected into the bladder, and later expelled harmlessly, with urine. As a physician, it's my responsibility to always explain this before surgery, so patients aren't caught off guard or left feeling discouraged afterward. The second scenario, however, is quite different. This involves surgery for prostate cancer, known as a radical prostatectomy. In this case, the goal is to remove the cancer completely, which requires taking out the entire prostate gland, along with the seminal vesicles. Because these organs are responsible for semen production, ejaculation no longer occurs after this operation. While it's still possible to feel the sensation of orgasm, a so-called dry orgasm, there will be no fluid expelled. Additionally, this surgery is more complex and carries two significant risks: urinary incontinence and erectile dysfunction. That's because the nerves that control erections run very close to the prostate and can be damaged during the procedure. Fortunately, with advancements like robotic-assisted surgery, we're often able to preserve these nerves and greatly improve patient outcomes. After everything we've covered, I want to leave you with one powerful and important message. There is no magical formula to prevent prostate cancer, no perfect diet, no miracle supplement, and no specific number of ejaculations can guarantee protection. Your most valuable weapon is prevention through proper medical care. Getting your yearly checkups with a urologist, monitoring your PSA levels, and undergoing a digital rectal exam when recommended. These are the steps that truly make a difference and can save your life by catching any issues early on. That said, maintaining a regular ejaculation frequency seems to offer health benefits, but it's only one part of a much bigger picture. So, what are the other pieces that science has proven to be essential? First, don't smoke. Keep your weight in a healthy range. Eat a balanced diet that includes plenty of vegetables and minimizes processed foods. Most importantly, stay physically active. Sedentary habits are among the worst enemies of your prostate and overall health. Be wary of internet miracle cures and quick fixes. Health is serious and requires proper care. If you want to learn more about starting your screenings or truly understanding what your PSA test results mean, I encourage you to watch another video I've prepared on my channel, where I explain everything about prostate cancer in detail. I sincerely thank you for spending this time with me and trusting the information shared here. If you found this video useful, or if it answered any questions you had, the best way to support my work is by liking, sharing with loved ones, and subscribing. Your support helps me continue creating honest, science-based health content for many more people. Take control of your health. Until next time, Dr. Bryam.